ankle joint is right around the anterior talofibular ligament, which is the front ligament of the ankle joint complex. That's the most common one to sprain. And of course, there are varying degrees of ankle sprains, and we can talk about that another time. When you first twisted your ankle a month ago, did you have any bruising or swelling at that time? So if you look, you can see you have a pretty big pit right here where I just pushed. You see that? We call that pitting edema. That's pretty conclusive for a ligament problem in that particular area. Let me kind of examine along here. 30% of the time, there's something called a stress fracture that doesn't show up on a regular x-ray. Oftentimes, I can see it when I use the ultrasound. So I'm going to put the ultrasound transducer on your foot, look around over here, but I'm also going to look at your ankle ligaments as well. So when we're looking at the ultrasound screen right there, the area that's quite black is definitely indicative of concentrated inflammation. Back here, I see the tendon, peroneus brevis tendon, coming in, attaching, inserting into the base of the fifth metatarsal, which is that area that's really quite dark and black there. Actually, a little higher up, like kind of right there. Well, right there, exactly right there. Yeah. And then as I move forward, we kind of get away from that, and it really more or less normalizes. It looks to me like you damaged two areas. All right. Neither one is severe, but enough to obviously be causing you discomfort a month later. On the side of your foot here, there's a muscle up here on the calf that as you come down the leg, that muscle becomes tendon. That tendon goes down, follow my finger, it goes behind the ankle bone, around the heel, and along the side of the foot, and attaches right to the bone here. That tendon bone junction where they come together is very inflamed, and that's what I saw on the ultrasound right there. Here in your ankle, there are 3 ligaments that hold the ankle together. There's one, and I'm going to make it simple. There's one in the front, there's one in the middle, and there's one in the back. You've damaged the one in the front. I think it's a partial tear. I don't think it's a complete tear, but I think it's a partial tear. The good news is, in most cases, they go on to heal uneventfully. Now, as we get older, it usually takes longer for us to heal. I think, and obviously you're not having pain when you're walking, only when I push on it, right? Right. So I think it's better than it was a month ago. I think for this, I would recommend ice, a couple of times a day for like 20 minutes. And I would recommend just kind of not overdoing it activity-wise for this. For this, I'm going to recommend an injection. So what I'd like to do is inject a little bit of local anesthesia and a little bit of cortisone. And what that will do, effective for you, and I'm sure it will be, is it's going to greatly reduce the amount of pain and inflammation you have here on the side of your foot.